Hello there. My name is Ariana Stark, LPN, and I'm an Indiana State University student in the LPN to BSN program. This is my health education project on diabetes management. A few learning objectives for today include: what is diabetes? What are the different types of diabetes? What are the treatment options for diabetics? The long-term complications and common symptoms of diabetes, and we're also going to go over some local resources to the Dayton, Ohio area. Diabetes, which is also known as diabetes mellitus, is a chronic multisystem disease characterized by either hyperglycemia from abnormal insulin production, impaired insulin use, or it can be a combination of both of these dysfunctions. Approximately 29.1 million people, or 9.3% of the population, lives with diabetes. And diabetes is also the 7th leading cause of death globally. Having diabetes, especially uncontrolled diabetes, increases the risk for heart disease, stroke, hypertension, and high cholesterol. What is insulin? Insulin is a hormone made by the beta cells of the islets of Langerhans in the pancreas. Normally, insulin is continuously released to maintain a homeostatic blood glucose level. Insulin controls blood glucose by transporting glucose across cell membranes, which removes it from our blood systems. A normal blood glucose ranges from 74 to 106 milligrams per deciliter. Prediabetes, which is the precursor to diabetes type 2. People in this range are at increased risks of developing diabetes type 2. This is diagnosed by an impaired glucose tolerance test and/or an impaired fasting glucose test. Prediabetes is the intermediate stage between normal blood glucose homeostasis and diabetes. People that exhibit signs of having prediabetes may not have symptoms, but the damage is done over time to the heart, vessels, and other parts of the body. The different types of diabetes include type 1 and type 2 diabetes. Type 1 diabetes is also known as juvenile onset diabetes and insulin-dependent diabetes. It usually has an early and abrupt onset, but it can really occur at any age. The body develops antibodies against insulin and/or the beta cells that make insulin, and soon insulin production dwindles and can cease. In type 2 diabetes, it's also known as adult onset diabetes. It's more common to develop this type of diabetes later on in adulthood, but it can also occur at any age. It's usually preceded by a gradual onset within that pre-diabetic range that may go undiagnosed for many years. Type 1 diabetes is caused by an endogenous insulin absence. The primary defect is an absence of the minimal insulin production that we need to maintain that homeostatic glucose levels. This can be caused by environmental viruses and/or toxins. It can also be caused by an islet cell antibody presence. Those destroy insulin and the islet cells. In type 2 diabetes, endogenous insulin is initially increased in response to resistance, but it declines over time because the body just doesn't recognize that insulin. It has an insulin resistance as the primary deficit. The environmental causes for type 2 diabetes usually includes obesity and a lack of exercise. In type 2 diabetes, there is no islet cell antibodies. Symptoms of type 1 and type 2 diabetes are very similar. However, you will see an increased weight loss in type 1 diabetes, where in type 2 diabetes, You'll typically see a tingling in the hands and feet much quicker than you would see in type 1. Ketosis is present in type 1 diabetes, and ketosis is only present in type 2 diabetes with situations of extreme stress or infection. Insulin therapy is required for all patients with type 2 diabetes, and they also need strict nutritional therapy to help them keep the glucose levels within range. Insulin needs for a type 2 diabetic will gradually increase over time with an increased need during stress or infections. And both types of diabetics will experience frequent vascular and neurological complications. Diabetes diagnostic testing includes a blood test called an A1C test. Any result of 6.5 or higher is considered diabetic, especially if that test continues to stay above 6.5. You may also experience a fasting plasma glucose test, where the blood sugar is measured after 8 hours of fasting. And you may also experience an impaired glucose tolerance level test, where the patient drinks a sugary drink and the amount of sugar processed by the body in 2 hours is measured. A symptomatically hyperglycemic patient with a blood glucose of 200 milligrams per deciliter may also be considered diabetic clinically. In order to manage a patient with diabetes, this patient and their caregiver must receive adequate education. Usually you can have your diabetes educator reach out to them, or you can get them in touch with a diabetes educator for the best well-rounded education. These patients also need effective education in blood glucose self-monitoring. A dietitian referral will help them understand the type of nutritional restrictions that they will receive going forward. And they will also need some information on how to adequately exercise to help manage their diabetes. Some drug therapies for insulins include long-acting and short-acting. Patients may also be on an oral agent for their diabetes, such as metformin, Januvia, Invokana, Jardiance, and Victoza. Enteric-coated aspirin may also be prescribed, along with ACE inhibitors, angiotensin II receptor blockers, and antihyperlipidemics. Some diabetic complications include retinopathy and blindness, heart attacks, peripheral neuropathies, diabetic foot infections, permanent kidney damage, and cerebral vascular disease. And this is mostly because those muscles and vascular systems just cannot support themselves because of the effects of diabetes. Some additional resources that are specific to the Dayton area include Diabetes Dayton. This includes free education classes, including a diabetic adolescent camp for teenagers, A1C testing, free insulin supplies, and insulin assistance. There's also Premier Health Diabetes Detection and Prevention through Miami Valley Hospital. This includes online classes as well as diabetes support groups. The local YMCA also runs a diabetes prevention program. And what's really awesome about this YMCA program is that membership is not required for these education classes and screenings. You may also find more information about diabetes through the American Diabetes Association. This is a great resource for education and additional resources for diabetes for the American population. This concludes my presentation. Thank you for watching.